ashver.com.
Hello and welcome to ashver.com. You are watching an interesting video on bleeding in early pregnancy. When should you be worried?
Please read the disclaimer carefully.
Perhaps the most terrifying thing a pregnant woman can experience is vaginal bleeding. Miscarriage is an unfortunate and common event in early pregnancy, and modern medical science commonly admonishes women that if there is bleeding, they should contact their doctor straight away. While it is always advised that pregnant women have an obstetrician selected to care for their emergency visits, women also need to be aware of the common causes of bleeding in early pregnancy. Nothing puts a woman's mind at ease like understanding the reasons why she may find pink in her panties during the early stages of a pregnancy. If you experience vaginal bleeding during early pregnancy, please be certain not to panic. It's likely that you're experiencing a normal pregnancy with some simple spotting. Worry can increase the risk to you or to your baby, so try to relax and consider the important facts before calling your doctor. While you will still want to put a call in to your doctor or midwife, make the call armed with facts that may help you to understand what's going on with your body. Information is your ammunition when doctors aim to perform procedures you don't want. Remember that doctors and hospitals can be stressful, and that stress is bad for the baby. Fill up on information from various sources and then contact your doctor when you have a solid view of the situation. Please note that the author of this article is not a doctor, nor has she been to medical school. She is, however, a mother who has been through 4 successful pregnancies and has experienced vaginal bleeding during pregnancy. Blood comes in 3 colors, and you will notice the difference in your panties or when you wipe after using the bathroom. Before you consider calling your doctor, note the color of the discharge that you're experiencing, as this will be significant to a trained doctor or midwife. Remember that in general your well-being is their first priority, even if they don't always do things right, and your ability to give them all the information will aid them in assisting you. First, be reassured, pink blood usually isn't something to be overly concerned about. Pink spotting is quite normal during early pregnancy. In fact, you may experience some pink or light red bleeding at the time that the fertilized egg implants on the uterine wall, implantation. The bleeding that you experience early in pregnancy is actually coming from your cervix. During pregnancy, and particularly in the early phases of the first pregnancy, your cervix is settling and preparing for the work that it's going to do, protecting your uterus from infection and then later, opening to allow the baby to come out. Your body is going to experience a lot of changes early on in pregnancy, and this is only one of them. As the cervix settles, it may bleed a little bit, but this isn't typically something to worry about. If this bleeding is pink, light or dark, or watery, watch for further developments, but you shouldn't need to contact your doctor or your midwife unless you begin to experience cramping as well. Please do note, however, that occasionally cramping and bleeding accompany one another at the time of implantation. Rest assured, on that note, that you won't know you're pregnant yet, so you're less likely to be worried. Many women report brown vaginal spotting during early pregnancy. They often describe that the blood comes out in clumps, and have rarely described it as clots. This can be alarming because brown spotting usually comes in higher volumes than the aforementioned pink spotting, and women who are hoping to hold on to a pregnancy don't want or need to take additional risks with their bodies. The important thing to remember, if you're experiencing any kind of spotting, is not to cause yourself more stress than is absolutely necessary. In most cases, brown spotting is quite normal during pregnancy, as well as at other times in a woman's life. As with pink spotting, brown spotting is generally caused by the changes that your body experiences during pregnancy. Your cervix is closing up tight to prepare for keeping the baby inside, and you'll experience more pressure against this part of your body as your uterus expands in preparation to become the home to a growing infant. It should also be noted that many doctors and midwives refer to this blood as old blood, meaning that you have, essentially, lost a scab on your cervix. Sometimes brown blood comes from the vaginal walls themselves as well, which is even less to worry. Brown blood is more concerning than pink blood because it is often heavier in volume. Although your doctor will likely tell you that you have nothing to worry about, it's best to touch base with him or your midwife about the fact that you've experienced some brown bleeding. Alerting your doctor allows him to be prepared if you need to call in because something has changed. If you see red blood in your panties or on the toilet paper after you've wiped, step away from the computer and go call your doctor. Red blood can be an indication of a serious problem in your pregnancy and you want to get it taken care of right away. Go take care of that phone call and then you can come back and continue reading while you wait for your doctor or midwife to call you back. Red blood during pregnancy isn't something that you want to mess around with, even though it doesn't necessarily mean you're having a miscarriage. Now that you're hopefully either not bleeding red or have called your doctor and are waiting for her to respond, let's talk about red blood during early pregnancy. There are two types of red blood that you may encounter. The first looks similar to the image of blood above, it's bright red, which usually means that it's highly oxygenated, and relatively thin. If you're experiencing this type of bleeding, chances are that you're going to be okay, unless you're bleeding in large amounts. You should still call your doctor and go in for a check, but the chances are that you've gotten a scratch somewhere, especially if you're only spotting. This is more normal than you might think. Most women simply don't worry about blood when they aren't pregnant. The other type of red blood is the type that you really want to worry about. This blood is darker, more like the color of your menstrual fluid, and may be mixed with some tissue. If you're seeing this type of bleeding, you need to call your doctor as quickly as possible, and she'll probably want to see you straight away. Don't mess around if you're bleeding red, even if you aren't cramping. However, it's recommended to call your doctor or midwife instead of rushing straight for the emergency. Reasons you might be spotting blood during early pregnancy. By itself, bleeding isn't necessarily serious. By itself, cramping isn't necessarily serious. In combination with one another, cramping and bleeding may indicate a miscarriage or other serious problem, and you need to get yourself to the hospital right away. Many women, myself included, experience bleeding during early pregnancy, and even beyond, and go on through normal pregnancies without further problems. Bleeding alone is no reason to panic, and if you aren't experiencing cramping with the bleeding, you may very well be just fine. Remember that nothing substitutes for a doctor's advice. If you're worried about the condition of your baby, consult with your doctor or midwife.
Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find a lot of interesting videos on wide range of topics here. Stay tuned and keep watching.